Hello everybody, welcome to Docitbabiezz. I'm Dr. Nupur Ghosh. Many of my patients often come to me with the queries about their baby's teeth. They ask me, ma'am, when do we start brushing their teeth? Which is the best toothpaste or toothbrush? Why do our children, they are getting cavities? What's the reason? How do we prevent that? So on and so forth. So I thought, why not share my knowledge with you people so that your children also, they have perfect oral hygiene. So let's start. Now, the first question which I would like to answer here is, when do we start brushing our baby's teeth? The answer to this is right after birth. So this is called the stage 1 cleaning. Now, how do we do that? We either take a muslin cloth or a cotton gauze piece. Before that, properly clean your hand. Now, wrap that cotton gauze or the muslin cloth on one of your fingers and gently clean the baby's gums, both the lower and the upper one. This is very important because this cleaning is going to affect the milk tooth which are going to come. If we don't take proper care of the oral health now, the milk tooth which come, they may have cavities. So it's very important here. Now the second stage which comes here, that is around say 4 or 5 months or maybe 3 months also, the babies, they start teething here. Now that teething phase is actually very painful both for the parents as well as the baby. They have got really sore gums. So what we bought for Jashvi then was this. This is the banana brush. It's super cute one and the babies actually love this. Now as you can see here, it has got this really soft bristles which actually help to soothe the sore gums. The babies tend to bite on it, they keep on chewing on it, and it actually helps to cure the soring gums as well as the cleaning purpose. Now some babies also have one of the tooth erupted at around 5 or 6 months. So this banana brush pretty well takes care of cleaning of that tooth as well. Now around say about 7 to 8 months, when 1 or 2 teeth have erupted, you can introduce the actual toothbrush to your babies then. And we introduced this, I want to show you, Chico toothbrush, and I think I really like this product. What I liked about this was the bristles, as you can see, they are pretty soft, very gentle on baby's gum. The head is small so that it can go to the back of the mouth for full cleaning of the mouth. The length of the bristles is pretty good, again for the cleaning purpose. Then as the babies, they don't have such a perfect grip, so the grip of this toothbrush by Jashvi was so good. I was very happy with that. She could easily grasp it. They have some rubber dots here which help in the easy grasping of this brush. So this brush, all in all, I really liked as the first toothbrush for your babies. The paste we introduced was this, again the Chico one. We took apple banana flavor. It's written 6 months plus. Now this is a perfect toothpaste. It's low on abrasive formula, so gentle on baby's mouth. It has got xylitol which helps in prevention of the cavities, and it has got no fluoride, so it was perfect for baby to start brushing. Now see, some extra points I would like to add on here are, how do you brush? Now you brush baby's teeth in small circular gentle motions. See, it has to be like this, circular. Okay, see, for adults it is like this motion is recommended, but for babies it is circular motion. Keep that in mind. Secondly, brush your baby's teeth twice, that is once in the morning and once at the night after the last meal or the last drink of the baby. Both the brushing are very important for the future dentition. The next point is, babies are sometimes reluctant on brushing. They don't want to brush, they spit up, they do this, that, and we parents, we lose our thing. Okay, no, okay, my child is not brushing, this, that. Don't worry, I mean, give baby some time, have patience. What you can do, 2 things you can try here. One of the things, give baby the command, give baby the brush, and okay, just wait. You'll find slowly the baby's putting the brush inside the mouth. Secondly, what you can try out here is, you can brush in front of your baby. Babies are so good at imitating. You are brushing and the baby is also brushing. So these are the 2 things you can try, and say just give up to 1 year or 1.5 years, 2 years. You'll find up to 2 years the baby is very perfect in brushing their teeth. So not a problem, but you always have to give a helping hand so that he learns faster. The next point I would like to say is, many parents come to me and say, my baby's tooth has not erupted, only one tooth is there, only two teeth are there. So don't worry on that. Every baby is special. There is a particular time when the tooth erupts, but it can be 1 or 2 months late or 1 or 2 months early, so you don't have to worry on that. By about 2.5 to 3 years, 20 milk tooth are going to appear, and they will appear. Don't worry. If it delays after that, you have to call the dentist. Now the next question frequently asked to me is, how do we avoid cavities and why do our babies get cavities? Cavities is a layman term. The scientific term to this is caries. So basically, see, there are two reasons why our babies they get caries. The first is poor oral hygiene. So I told you the entire process, how to brush, which brush to use, so twice a day. So do that for your babies. So that caters for poor oral hygiene. The second point is high sugar content in the baby's meal. See, basically sugar is not good either for the adults or for the babies. So try to cut out, if you're giving, also try to cut out that sugar thing in your baby. Now what you can do, some of the points I want to advise here is, first of all, don't give whole day at like after 1 hour the baby is taking sugary drinks or sugary meals. Don't do that. If at all you're giving, also just fix it. Try giving sugary meals after the main meal. Why? Because after the main meal your mouth is secreting a lot of saliva. Now if after that a baby is taking a sugary drink or a sugary meal, that saliva is going to neutralize the acid which is being produced by this. Why acid is being produced? See, what happens whenever we are taking a sugary meal, that sugar combines with the bacteria in the mouth and produce acid, and this acid is actually damaging your tooth and creating the cavities. So what we are doing is, when we are taking it after a meal, so we a little bit we are neutralizing it. Secondly, instead of sugary snacks, I've seen giving biscuits or candies to babies. Try giving some healthy snacks, turn on to some healthy options. Now what would be the healthy options out here? You can try plain yogurt, that is dahi. You can add some chopped fruits in that. Secondly, you can go for oatmeal. That's a very healthy option and babies actually love that. With jashvi it works pretty well. Oatmeal, you can, with oats you can try peanut butter. That's also a healthy option. Other than that, give some fresh fruits, not juices. I'm not talking about the juices, I'm talking about fresh fruits. You can give cooked vegetables. So there's so many options. You can even try eggs, they are high on protein. You can even try cheese. Now cheese is very healthy and cheese is very good for the oral health as well. So these are various healthy snacks basically you should turn upon instead of sugary snacks. Other than that, if I would not recommend giving fruit juice to your babies. If at all you want to give, just dilute it with water. 10 parts water, 1 part juice. That's the dilution level. So because you know what happens, these juices and all, they stick to the tooth of the baby and they're very damaging. So instead of fruit juice, prefer the whole fruit. The pulp is going inside, that's more beneficial. Okay, what you should avoid is here, the squashes and all have to be avoided. The fruit juice I told you, and don't give that chocolates and ice creams to your baby. Once or twice in a blue moon is okay, but not so often. Okay, that was it. One more advice to you: if your baby has turned 1 year, stop using bottle and encourage your baby to use a cup instead. Use a cup. So whatever your baby's drinking, the teeth are getting less exposed to that drink. The drink is actually going inside the tummy altogether. But if the baby is using a bottle, there's a lot of exposure to the teeth, to that sugary meals or the sugary drinks, whatever. So try and turn to a cup. That's what I'm saying. After 1 year, you can give baby water a lot. Water is very good for health also after 1 year, and it also rinses the mouth, so helps in prevention of the caries. Now this was some of the ideas how you can take care of the baby's tooth, and trust me, if these things are taken care of, cavities are not going to appear. Now how do you know cavities are appearing and when do you go to the dentist? See, first of all, if there's any kind of discoloration, any kind of brown, black, or the spitting. You see small pits, a very small pit on your baby's tooth, that's the sign of a cavity formation or a caries. So that's the time you should visit the dentist very fast. Don't delay, because these spread at a very fast rate and you would not know also when your child has just lost the tooth. Now, how do you introduce the baby to a dentist? See, I would recommend when you go for your regular checkups, just take your baby to the dentist, because the dental the dental clinic, sometimes the babies, they get terrified with the sight, they get terrified with the white coat, they get terrified with the sound and so many things. So it's advised that whenever you are going to a dentist for your regular checkup, just take your baby as well, and the baby will get accustomed to all these kind of environment. Now, baby has to go to a dentist for checkup after 1 year for sure, or you can also take the baby after the first tooth erupts. Now, get that in habit. After every 6 months or after a year you have to go, but I would suggest after every 6 months get the proper dental checkup done, so that any cavity formation, any caries, any malalignment that the tooth is this, that, all the things, they can be checked and treated properly. So that was it. Just brush twice, nothing is gonna happen for sure. This is the best thing. So you can just post all your dental questions, especially I'm here to answer. You can post on our comments section, and I hope that you liked our video. If you like it, just click on that subscribe button. Please subscribe to Docitbabiezz. Keep up your health, keep up your baby's health, take care of the teeth, they are very important. Take care, bye.